too.
And see how he's spread out? He's losing heat to the floor because he got. Oh, very good. Okay. Yeah. See. Benny. Pretty boy. Now, how old is he again?
3.5.
3.5, and they live
About 7 to 10 years.
7 to 10. Yeah. And how much does he weigh?
Anywhere between 1 to 2 pounds.
Okay, and then he's vaccinated for rabies and
Canine distemper.
distemper. Yeah. And you thought the rabies was ferret rabies? I can't remember.
I think it was the canine distemper one. Is like ferrets. So I'm going to talk about cancer in ferrets.
And we have a ferret in class. Yes.
First of all, we have to Benny-proof the room. As you can see, he loves getting into people's bags. He will steal your stuff. The next step is just teaching him to steal wallets and bring it to me. So just make
Let
sure
him
everyone's
loose in the student union and just wait till he brings stuff back. That'd be handy.
Yep. So different types of cancer in ferrets. So ferrets suffer unusually high incidence of cancer. The most common types are insulinoma, lymphoma, adrenal cancer, and various skin tumors. And about 50 to 70% of ferrets over the age of 3 will develop adrenal cancer or insulinoma or both. Benny is 3.5, so I do need to take him to the vet every 6 to 8 months to make sure he's doing okay and doesn't have any type of cancer.
Okay, so before you advance, now that begs the question, and if it's almost like you have a good, this is bad, but it's a good population to develop cancer, right? So are they using a ferret as a model of how to prevent cancer? Because, I could see 50 normal ferrets, divide them into 2 groups of 25, and then, you know what I mean? One is a control and one is drug X or diet X, and then see over time. You know what I mean? Using control, if you have that many, that much cancer incidence, it's like, can you prevent it? Anybody know about that? Because animals are used a lot for human medicine models, right? And yeah, are you familiar with any of that or ever run into that? Okay, so maybe it's not practical. I don't know.
So I'm just going to talk about a few of the ones that I mentioned. For insulinoma, it's the tumor in the pancreas that produces an oversupply of insulin. So all these pictures, by the way, are of Benny. So ferrets are strictly carnivores. They can't have any type of sugar, carbohydrates, or anything like that. So that's why they could possibly, this would be really bad for them. This causes low blood sugar. To diagnose this, they would do a test by having the ferret fast for 4 to 5 hours and see if there's low blood sugar. The reason they fast it is to make sure that the reason they have normal blood sugar isn't because of the food. Some symptoms would be weakness, weight loss, drooling, difficulty to wake up, staring blankly into space, dullness, vomiting, seizures, and possibly coma. And a treatment would be surgery to remove the tumor, dietary therapy to make sure he's eating correctly, or medicine. The adrenal tumors are tumors of the adrenal gland in ferrets can cause excess secretion of the sex hormones, and that affects the organs in the body. To diagnose it, the veterinary dual palpation, radiography, and/or ultrasound. Some symptoms are hair loss, the thinning of the skin. Ferrets have really thick skin, so you ever see ferrets playing together, they'll be biting each other. That's just normal. That's how they play. Swelling of the vulva, diarrhea, strain to defecate, prostatic enlargement, weight loss, pot-bellied appearance, and depression. When I took him to the vet recently to get his canine distemper vaccine, she did do a palpation, and she did tell me that he could possibly have this because his prostate looks a little big, but she said don't be alarmed yet, bring him back in 6 months, and if it's bigger, then we'll have to start taking further advancement on that. If it's not, then he's just fine. And then treatment for that would be surgery or medicine.
So I've got a couple of comments. Now, how did she determine that the prostate was enlarged?
She just felt around.
Felt around where? I'm curious.
I don't know. She just
okay.
She was just feeling around, and she was telling me all this information.
So that's amazing, isn't it? She can pick up a ferret and go, the prostate's a little enlarged? Wow. I mean, right? Okay, I want to go back here to the adrenal gland. You should know that the adrenal gland actually is two parts, right? The adrenal cortex, which is the outer region that makes steroids, and the inner part is the adrenal medulla, which makes catecholamines. What a lot of people don't know is the steroids that are made, you know, the most common one is cortisol. You hear that all the time. But all the sex steroids can be made by the adrenal cortex. And under certain circumstances, like what you're saying, here, a tumor, they can make too much. And then you get, like, here's one thing, if there's too much estrogen coming out, swelling of the vulva. Now, Benny's a boy, right? Yeah. So he wouldn't have that, obviously, but he would have maybe this, because the steroids feed the prostate and make it larger, okay? So it was very interesting, but a lot of people don't realize that these sex hormones, the primary place they come from is the gonads, right? Ovaries and testes, that's what you always think about. But under certain circumstances, they can come from the adrenal cortex, which is amazing. And it doesn't always have to be a disease state, because one time I had overactimized heifers, and I gave them big doses of ACTH, which is, you know, the pituitary hormone. And lo and behold, in the blood of those overactimized heifers, I got a lot of progesterone. And you think only progesterone comes from the, like, the CL on the ovary. But it was just to prove that under maybe stress, you can have hormone levels rise, not because of a tumor, but because of stress. So very interesting. See how we're partners? Mm-hmm. Okay.
Lymphoma is the uncontrollable growth of certain blood cells called the lymphocytes. To diagnose that, you have to do an X-ray, ultrasound, bone marrow analysis, so a lot more to be able to diagnose this. Blood sampling and lymph node biopsy. Some symptoms are anorexia, weight loss, rapid onset of weakness, acting tired much of the time. And treatments, you have to do chemotherapy, medicine, or surgery. That's it.
Okay. Questions about the cancer in ferrets or anything about ferrets, right? I mean, maybe you're curious about something. I'll let you point it.
Is he the first ferret that you've had? Have you had experiences with other ferrets that have had cancer?
No, he's the first ferret I've ever had. And I got him when he was 2 years old. So I've only had him for a year and a half.
Two questions. Where did you get him if he was 2 years old?
So a friend I've had since I think my sophomore year, she had him, and I would go over her place and always play with him. And so when I finally that was when I lived in the dorm. So when I moved into an apartment, I really wanted a ferret, and she knew I was looking for one, and she couldn't care for me anymore because she got a dog, and so she gave me a ferret.
And then, are they nocturnal or like crepuscular or?
They sleep like 18 hours a day. So you're supposed to only take them out for 2 hours at a time for playtime. Other than that, they're just sleeping.
So they're not officially like nocturnal then, probably. Like a rat, and you know, right, rodents are usually nocturnal. I think it's sideways. Is the wind blowing or what? No, don't laugh at me, you said. Okay, other questions? So would you, knowing what you know now, would you recommend a ferret as a pet? And if so, any precautions like, oh, don't get it if you have this in your household, you know what I mean?
Yeah.
What's your recommendation?
If you can stand strong odor, then yeah, you can go ahead and get a ferret. If you're going to be picky about the smells, then no. So with their skin, ferrets do have like a musky odor. He loves to play catch or chase.
Chase.
So they do have like this musky odor, but it's very controllable. If you smell him, he does not smell bad at all. And I haven't given him a bath since May. And you shouldn't be giving them a bath unless they're dirty. If not, their glands are just going to produce more oil that goes on their skin, which can make them even smellier. Also, when they poop, that smells really bad. It's not like little pellets like rabbits or something. It's like legit poop. Other than that, he eats cat food because he has like digestive issues that like the previous owner told me. So I buy him like pretty expensive cat food.
And he does well on that.
Yeah, if you give him anything else, he'll like look sick, doesn't want to play.
Okay,
He'll
wow.
smell 10 times worse.
Okay.
Yeah.
So diet has an effect on odor then, you're
Mhm.
saying? Okay.
Yeah.
How do you go about house training ferret, or do they go outside, or do you have a litter box?
So in his cage, I have bedding all on the bottom, and then he just kind of picks a corner. But I recently bought an actual litter box and put it in the corner, and I'm currently training him to do that. But I did get him from the previous owner already potty trained. So if I will let him out, he will go back in his cage to like do his business.
Okay.
At the beginning, did you say that you gave him like rabies and you gave him peanut December? So
Say
why
that
did
question
you not-
again. Ask it.
So the vaccination
Okay.
for ferrets. that's-
Vaccination. Yeah.
It's rabies and you said canine December. Why canine December?
So a lot of diseases that animals contract are sometimes species specific, except for the canine distemper. He can contract that, and that could be potentially fatal to ferrets. And I work with a lot of dogs, so I got it for him now. But it's not necessarily necessary. That's what the vet told me. The rabies, obviously, that's a law. You have to do that. But that one is not necessary unless you're dealing with a lot of animals.
And that's why you're doing it, yeah.
Yeah.
You know, when you have exotics, a lot of times there's not a specific vaccine for that species. So a lot of times they'll use canine whatever vaccine on certain animals, and that might be a good topic for somebody, because it's not, when you're a company making vaccines, you make big batches, and if you have some market that's small, you won't even bother making it. You know what I mean? They might have the technology to make it, but it won't be cost effective. So in that case, you said the rabies was probably a ferret rabies vaccine.
I think the rabies was any animal, like.
Oh, any animal.
Yeah. I think
And
the
then,
distemper one specifically.
okay, then the canine distemper.
Yeah, because for the rabies one, I went to a regular veterinarian. He's like, yeah, I got that. That's for any animal. But
Okay.
the other one, you have to go to an exotic vet.
Okay, yeah.